In non-small cell lung cancer, between 30 and 50% of stage 1 and 2A patients will die within 5 years of resection, almost always due to recurrent disease. What's even more tragic is that for many patients, this disease could be eliminated using simple platinum doublet adjuvant chemotherapy. In fact, the NCCN already recommends adjuvant chemotherapy for stage 1 and 2A patients who are at high risk after resection. But the issue is that, until now, there hasn't been an adequate way to identify which patients would benefit from adjuvant chemotherapy. Conventional TNM staging doesn't adequately segregate patients who are at high or low risk of recurrence. This becomes even more important when consideration is given to the promise of targeted therapies and immunotherapy in the adjuvant setting. These extremely expensive and still morbid therapies can't be applied to all stage 1 to 2A patients, since 50 to 70% are cured in the operating room. A clear way is needed to identify which 30 to 50% of patients will benefit from adjuvant therapy. DetermaRx provides a clear molecular risk indication of which patients are likely to benefit, giving clinicians and patients the confidence needed to make the best possible care decisions for all stage 1 to 2A patients. Molecular risk discrimination has already transformed early breast cancer care, with tests like Oncotype DX enabling clinicians to personalize their treatment strategy based on each individual patient's risk of recurrence. DetermaRx is a similar gene expression profile for non-squamous, non-small cell lung cancer. The DetermaRx test looks at the expression of 14 genes in resected lung cancer tissue. The results classify the cancer as having a high, intermediate, or low risk of recurrence and can inform adjuvant chemotherapy decisions. In medical oncology, data is very important, especially reliable data. Prospective data in 250 patients has shown a dramatic improvement in disease-free survival and freedom from recurrence in DetermaRx identified high and intermediate risk stage 1 to 2A patients who received adjuvant chemotherapy compared to those who were not treated. Patients with early-stage resected non-small cell lung cancer will continue to eventually relapse and die from metastatic lung cancer without a validated tool for risk stratification. The DetermaRx assay has been validated in more than 1,600 patients to accurately discriminate those at both high and low risk of recurrence, with as many as 35 to 60% of patients being reclassified compared to risk criteria currently recommended by NCCN guidelines. Recent prospective validation data took into account the EGFR mutation status of patients, along with DetermaRx results. Findings demonstrated adjuvant chemotherapy benefited those who were found to be high risk by the DetermaRx test, regardless of EGFR mutation status. For clinicians, this indicates that DetermaRx may be an effective tool to identify high-risk patients that could benefit from adjuvant chemotherapy prior to receiving a TKI. DetermaRx can be performed on any non-squamous, non-small cell lung cancer that has undergone resection. FFPE tissue is sent to Oncocyte's CLIA-certified lab, and results are returned in time to facilitate discussion with patients regarding the potential benefit of adjuvant treatment. DetermaRx finally gives clinicians a scientifically validated means to better implement current guidelines with the potential to save more lives. Please contact Oncocyte for more information on how to order this simple, life-saving assay.